Welcome to Mayo Medical Laboratories Hot Topics. These presentations provide short discussion of current topics and may be helpful to you in your practice. Our speaker for this program is Dr. Glen Roberts, a professor of laboratory medicine and pathology and microbiology at Mayo Clinic, as well as a consultant in the Division of Clinical Microbiology. In this series, focusing on hyaline fungi, Dr. Roberts discusses perhaps the most common fungi that you will see in the clinical laboratory, and a significant cause of disease in immunocompromised patients, including transplant patients. This module examines miscellaneous septate hyaline fungi. Thank you, Dr. Roberts.
Thank you, Sarah, for that introduction. I have nothing to disclose. First, we're going to discuss how to make mounts for a fungal culture so that we can make an accurate identification. This image you see here actually is representative of what happens in the laboratory many times, where a plate is contaminated with many organisms and you need to figure out how to identify those that are present. The next image shows you a schematic of what you might see. This is a drawing with fungi exhibiting all the different kinds of spores that might be produced. Maybe not all, but a lot of them. It gives you an idea of what you might expect to find with certain of the cultures. And I kind of call it the universal fungus because it has everything there. You can notice in the center there's a tall stalk with a round sac at the top, and this is a sporangium with the zygomycetes. Then we go from there down to penicillium, which is like about 2 o'clock, which has different type of sporulation, and you can just look around in there and see that many of these fungi sporulate differently, and so we will begin to look at some of these as we go along. The first preparation that can be used in the clinical laboratory, and probably the most widely used, is the Scotch tape preparation. Basically what you do is to take a piece of Scotch tape and tear off a piece and fold it up so that the adhesive side is facing downward. And what you do is you touch the colony with that piece of Scotch tape. You stretch it out and place it on a slide that has a drop of lactophenol aniline blue on it. The Scotch tape will then stick to the slide, and it'll allow the fungus to be stained with the dye that you see in the center there. This is an example of where you might end up taking a Scotch tape prep from the wrong place. Many times, if you take it from the very center of the colony, that's the oldest part of the culture, and that's where it sporulates the most heavily. In this case, this is what happened. You see all these spores in here, and it's difficult to see because there are so many of them. The bottom line is what you need to do to make a good mount is to make them out from an area that is in between the outside advancing edge of the culture and the center of the culture growing up. So it's kind of in the middle. Now, this is an example of what you would like to be able to see. This is an organism that has all the spores attached to the cnidophore the way they were grown up. This is what the Scotch tape prep allows you to be able to do. If you get it from the right place in the culture, you will see the spores that are attached just as they were growing in the culture. They're attached to the Scotch tape, and then you can see exactly how they're produced and exactly how they look. And in this way, you can be able to get an idea of what it is that you're dealing with. Another kind of time-honored preparation is the wet mount. This is where you take a little bit of the colony, cut it out of the agar with a wire that's bent at a right angle, and you take a little bit of the colony along with some of the supporting agar, and you place that on a slide with some lactophenol aniline blue. This is an example here of where you see the piece of agar that has been taken up along with the culture. One of the things you have to remember is that it's easy to get too much of the supporting agar on the slide. If you do that, when you put the cover slip on, if it's too large, what it will do is it will fly out from underneath the culture slip onto the top of the bench where you're working, and that's not what you want it to do. So you have to take a smaller piece. Here you can see the cover slip is going on there, and it will be flattened out unless it's too large, and you'll be able to see the culture kind of as it's been growing. The problem is with a mount like this is the spores don't stay connected to where they were attached. The pressure that you put down with a pencil eraser or some other object on there to flatten that out causes them to disassociate from the hyphae or the cnidophore that they're produced on. Probably the Scotch tape prep is the most universal one right now, and the wet mount may be second. And then as a last result, we have in the past used what's called a slide culture, a micro slide culture. This is an example of what that is. Basically, when you have a problem with a culture and you need to see how it produces the spores in detail, what you do is to take a plate of 2% agar, just water agar, and you place a glass rod that's sterile in there, or you can just lay a slide on top of the agar like you see here. The slide's sterile, and what you do is you take a little bit of the culture and you cut out like a circle or like a square with a wire or with a sterile test tube. Place the agar plug on the slide in two places, either end. And then you inoculate the four quadrants of the plug with the culture. Then you put a cover slip on top of it. And as it grows, it produces spores just the way it does in the culture, but they'll be underneath that cover slip. And what you can do, when you think the culture is mature, is you can remove the cover slip, take it off, put it on a slide with some lactophenol blue, and look at it underneath a microscope. And you probably will see the spores just as they have been produced underneath that cover slip. Sometimes you happen to look at it too early so that you don't see things that you need to see, and that's why we have a second plug on there. You can go back and put a cover slip on top of that first plug and let it grow longer if you like to. Here's where you take the cover slip off and put it on a slide with a drop of lactophenol blue, and then take a look at it underneath the microscope. This is the cheap way to do it. It works well. You take a piece of filter paper, put it in a sterile petri dish, break an applicator stick that's sterile in two, and then put the slide on there with a couple of agar plugs and inoculate it. Put a cover slip on top and let it grow. And you put some water in the bottom so that there's enough humidity in there, and that filter paper will absorb the water. The next presentation here will deal with the miscellaneous septate hyaline fungi that you don't see in the clinical laboratory all that often, but it's kind of nice to recognize them if they happen to be present. This next one is called Trichothecium. Generally the species name is Trichothecium roseum because it's kind of a rose-colored colony. It produces conidiophores that are single. It produces conidia that have two cells on them, and that's all. And they're kind of club-shaped. And the conidia, when they're produced, are produced in what we call a zigzag column at the tip of the conidiophore. The next slide shows you the culture, kind of a rose-colored culture. These are the spores of Trichothecium. They're a little bit dark and just not quite crisp in terms of being able to see them. But the spores are kind of elongated, and they're divided in two, and they come off one side then the other, one side then the other. And it's one that's easy to recognize. And there you see the spores much better. Two-celled, and they come off in a zigzag fashion. The funny thing about mycology, the rule is that if it's something that's really easy to recognize, you don't ever see it. That's one of the problems that we have. But you can see this one. I think if you saw it, you'd know what it looked like because characteristically it has the two cells. And here you see two cells again. And you can see on the one on the left-hand side about 9 o'clock, the point of attachment is kind of a flat area. The next one is an organism that's very tiny and very delicate, and it's called Beauveria. The cells that produce the spores are inflated at the bottom, or the base, and these cells terminate in what we call a thin zigzag apex. So at the tip, you'll see the spores coming off one side, then the other side, one side, then the other side, at the tip of a little point. We call this sympodial production of conidia, where they come off one side and then the other. And the conidia are round to oval, and they are tiny and delicate. This happens to be an insect pathogen. Sometimes you'll see this. You'll see a dead wasp or a bee, and you'll see that there's mold growing out of it. This is what killed the thing. This is a culture of Beauveria, and it's kind of unique in itself. The colonies are heaped up and they're like a round ball. And they're not just flat on the top, they're very heaped up. And then the next one you can see where there's a lot of organism present, fills up the culture plate, but the colonies are still elevated on the top. Here you see microscopically how it produces the spores, or the conidia. The conidiophore is a very short, kind of curved, very delicate structure. And at the tip, there's a little thing that protrudes out that is the apex where the spores are produced, like a little connected to the top of that thing in a very, very delicate connection. They go back and forth in terms of producing conidia. Hard to see unless you use something like oil immersion because the spores are so small. But they're produced in that zigzag fashion, and that's what Beauveria looks like. And here you can see it again. This has many more spores. If you look at about maybe 430, you can see that the spores are produced kind of on one side and then the other. And if you look closely, you'll see they're attached by a little tiny structure. Not the easiest thing to recognize because it is so small, and you do have to use oil immersion to be able to recognize the structures. This is another one that is seen in the clinical laboratory, and it's one that's an important organism because it actually is a totally drug-resistant strain for the most part. And when it infects someone, it's very difficult to treat. This is one called Scedosporium prolificans. This organism had another name before it was called Scedosporium prolificans. It was called Scedosporium inflatum. And it was called that because the base of the conidiphore was inflated or swollen. And it's very obvious, and you'll see this here as we go along. It produces numerous dark brown conidia formed from short anellophores. These anellophores are the structures that have the little growth rings around them. And if you look down farther down at the bottom towards the base, you'll see that the base of this structure is inflated. And the conidiphores are arranged singly or in branch clusters. This organism produces two kinds of spores, some that are brown and some that are not. And this happens to be Scedosporium prolificans. And if you look at the spore, and then you follow it down, you see what looks almost like a phylid. You follow it down, look at the bottom, you see that it's swollen. Very tiny, delicate organism. And if it's swollen at the base like this, it's Scedosporium prolificans. There's actually one at the top at 12 o'clock with a swollen base. This is one where you see it very well. You notice at the top there are a cluster of conidia, and notice how brown ring, you can see the brown pigment on those. Follow it down and look at the conidiphore. It is swollen before it is attached to the hyphal strand. So some of these spores in here they happen to be brown in this particular mount. In others, you will see that some of these conidia are not pigmented at all. They're hyaline. So this is Scedosporium prolificans. This is a very important one to let the clinician know about because it causes sinusitis, it causes disseminated disease, and it requires a lot of attention to detail to treat these patients with this organism.